Welcome to this simulation-based learning activity. The purpose of this pre-brief really is to introduce you to what simulation is and give you a little idea of what we're going to do today. So simply put, simulation is just an experiential learning without putting the patient at risk. So it's a safe learning environment. You're going to have the opportunity to apply the knowledge and skills that you've learned in the classroom and also in clinicals and in clinical practice to a situation that replicates a clinical scenario. The purpose of this is learning and not assessment, so I want to reinforce we are not grading you today. This is not an evaluation. And I also want to restate re-emphasize that our basic assumption is you're all intelligent, you're motivated, and you're here to do the right thing. So it's not unusual that during simulation participants get to feel a little bit anxious, a little bit overwhelmed, and as a facilitator we understand that. So really don't feel if you do something wrong, we're not going to judge you. We know that sometimes when you get anxious or stressed, we don't always act like we would if we were calm, and that's one of the wonders of simulation. So we know that we do want a certain level of stress because it has been shown that stress actually enhances learning, but we don't want to stress you so much that you completely freeze. So we really do our best to make it as safe as possible but realistic. Simulation's not about role playing, so you're going to be in there and you're going to be the role that you are. So you're going to be in there as nurses today, and we've done the best that we can to make it real as possible. However, at the end of the day, it is simulation by nature. That's a replication of a situation. So we depend on you. We ask that you engage as fully as possible and take advantage of this learning experience. As I said about stress, we know you may not perform exactly the way that you will in the clinical situation, but we'll still have a good opportunity to unpack what happened and reflect and learn. We will be videoing today, so that does add an extra level of stress. After each simulation, we're going to do a debrief, and all a debrief is really is a guided reflection. So I will be guiding you in your reflection of what happened, and it gives you the opportunity to reflect on some things that went well and maybe some things that you would do differently. Confidentiality is a real big part, like it is in the clinical arena. So please keep the patient information to yourself. Do not share with any of your colleagues. We want everyone to have the same learning experience. And also, if either of you make a mistake, be respectful of each other. We all make mistakes, and simulation is the best place to make those mistakes, but we don't want you then going out and saying, oh Michael, he made this really crazy mistake. So be respectful of each other, and what happens here stays here. We won't share individual information with your supervisors or any of your instructors, so be aware of that. So let's get started. I'm going to spend a few minutes now. We're going to actually go into the bed space. I'm going to orientate you to the mannequin. We are going to use a mannequin today, and also an embedded actor. And I will orientate you to the bed space, and then I will give you a report on